A patient today told me that they weren't interested in psychotherapy because in the past they had seen therapists and they felt like they were basically just chatting with a friend, is how they put it. And they said, I've got plenty of friends, there's no need for me to pay for that service. And I discussed with them that if someone is seeing a therapist, there's different types of therapy that you can partake in. But in general, therapy should not feel like you're just chatting with a friend. It should be very different. And some of the ways that it should be different is it should be rather one-sided. So the focus really should always be at all times on the patient and what they're struggling with and helping them with their struggles, finding coping mechanisms to deal with it or ways to work through their specific problems. So if it feels like a 50-50 conversation where you're each talking about each other's lives, that may not be a kind of real traditional form of therapy or a type of therapy that someone is really going to benefit the most from. Therapy should actually feel like work and should be hard, and there should be some times where you feel like you're pushing yourself. Often when someone goes through a good therapy session, they might actually feel a little bit worse because they've brought up and talked about some really difficult topics or things that may be upsetting to them. And that's part of the process of working through it. Additionally, in therapy, as I mentioned, the focus is really on the patient, not on the provider. But the provider, so one half of that conversation, the other side of that conversation, needs to really be monitoring the patient in terms of how they're doing and regulating that patient's anxiety or helping to regulate that patient's emotions. So for example, if a patient is talking about very difficult topics and they're feeling rather distressed talking about that, the provider should be monitoring that person and recognizing, or at least checking in every once in a while and saying, hey, how are you doing? Is this too much for you today? Are you handling this okay, etc.? So in many forms of therapy, that's going to be something that's going to be very important. And it's very different than in conversations just with friends. Although a good friend will notice if you're really struggling and say, hey, do you want to talk about something else, or should we distract ourselves a little bit from whatever's going on? In therapy, in a therapeutic relationship too, there's a lot of boundaries that there are necessarily with friendship. So if you're working with a therapist or someone's working with a therapist, it's important to recognize it's not appropriate to take the focus off of that work or take the focus elsewhere outside of regular sessions. So for example, patients have asked me in the past, hey, I'm coming into Philadelphia, I haven't seen you for a bit for a visit, but you want to go grab a beer or something like that. I don't have time for a session, but maybe after work or something. That would be completely inappropriate because it's not a friendship. This is a working relationship where you're focusing on just helping that individual, and the provider needs to be very cautious and be very careful at maintaining good, healthy boundaries because it's not a friendship. It is a professional working relationship. Different therapists, different individuals out there might have different views about this, and that's fine. But these are, I guess this is how I was trained in terms of being a therapist. If you have any questions about this or you feel this pertains to you in any way, please do set up an appointment with a mental health professional to discuss. And again, none of this is medical advice, and none of this is I'm not trying to dictate or tell anyone that they're doing anything wrong, etc. But in general, these are some of my thoughts about what therapy should look like.